Hi, I'm Dr. Del Rosario, and today we will talk about colds. The common cold is also called an upper respiratory tract infection. It is caused by a virus, and there are tons of different types of cold viruses out there, which explains why your child can catch a cold multiple times a year. Parents often express concern to me that it seems like their child is always getting sick. But this doesn't necessarily mean that they have a weak immune system. It turns out that a healthy child, on average, can actually get 8 or more colds a year. That means they can catch a cold as often as every 1 to 2 months. And how do we catch a cold? Colds are actually quite contagious, especially in the first few days after symptoms begin. They spread through person-to-person contact, breathing in germs when someone with a cold coughs or sneezes, or touching a contaminated object like a toy or a doorknob. Once we are exposed to a cold virus, symptoms will appear in a few days and usually will consist of runny nose, sneezing, congestion, and cough, and sometimes also fever, headache, muscle aches, or loss of appetite. So what is the treatment for a cold? Does it mean your child needs antibiotics? The answer is no. I spend a great deal of time in clinic explaining to parents why their child doesn't need antibiotics. The major take-home point I would like to make here is that antibiotics only treat bacterial infections, not viruses. So giving an antibiotic for a viral illness like the common cold is not effective and will not help your child get better. So if antibiotics are not the answer, then what can we do for our kids when they have a cold? The best advice we can give is called supportive care. This means giving Tylenol or ibuprofen for fever or achiness, using a suction bulb to clear out mucus in younger infants, or turning on a humidifier to moisten the air and help with stuffiness. Lots of parents ask me if it's okay to put Vicks on their child's feet or chest, and generally this is fine as long as it doesn't get into their eyes or nose. But in terms of over-the-counter cough syrups and decongestants, I would advise you not to give any to your child. Even though we used to take it all the time in the past, research over the years has shown that they have just not been effective in clearing up cold symptoms and can even have potentially harmful side effects in younger kids. So it's best to stay away from these over-the-counter medicines and stick with good old-fashioned rest and fluids. Most colds will clear up on their own within a week, but if you're ever unsure about whether your child has a cold or some sort of other infection going on, it's best to bring them in to their doctor to be checked. For Live Life Healthy, I'm Dr. Del Rosario.